In this video, we will be talking about different treatment options for obstructive sleep apnea. Treatment of sleep apnea improves sleep quality, daytime sleepiness, energy levels and decreases the risk of heart attacks, uncontrolled blood pressure and strokes. Severity of sleep apnea determined by the frequency of interruptions in breathing during sleep. Sleep apnea is categorized into mild, moderate and severe sleep apnea. In mild sleep apnea, airflow limitation occurs 5 to 15 times per hour. In moderate sleep apnea, airflow limitation occurs 15 to 30 times per hour, and in severe sleep apnea, airflow limitation occurs more than 30 times per hour. The main goal of sleep apnea treatment is to maintain airway open during sleep. Majority of the treatment options for sleep apnea require daily use of treatment device, which can be challenging for the patient and treating physician. Positive airway pressure therapy with devices such as CPAP or BiPAP is the most effective therapy available for treatment of sleep apnea. Pressurized air from CPAP or BiPAP devices keep upper airway open with the help of a mask covering nose or nose and mouth. As sleep apnea severity increases in supine sleep position, sleeping on the side improves the severity of sleep apnea. Several positional treatment devices such as slumber bump, night balance lunoa, Medcline positioning wedge, and sleep noodle are currently available. Weight loss with diet, exercise and surgery can improve the severity of sleep apnea. Mandibular advancement device can be used to treat mild and moderate sleep apnea by opening upper airway by repositioning of the mandible. Surgeries such as uvulopalatopharyngoplasty, maxillomandibular advancement and hypoglossal nerve stimulator are alternative treatment options for those who are not tolerating CPAP or dental devices. Expiratory E-positive airway pressure devices such as Bongo RX, Provent and OptiPillows are approved for treatment of mild and moderate obstructive sleep apnea. During inhalation, small valves open to allow you to breathe normally through the device. During exhalation, the valves close, directing exhaled air through specifically designed vent holes to generate expiratory E-positive airway pressure, which keeps open the airway until you inhale again. More short and comprehensive sleep health videos will be posted on our US Tele Sleep channel on a weekly basis. Please subscribe to US Tele Sleep channel to get to know more about sleep health.